So good day to all. Today we are going to continue the discussion about semi-solid preparations. The last video in this part as 4. So today, as a continuation, we are going to discuss the second method of ointment preparation, that is called trituration. So applicable in the bases or a liquid present in a small amount. Solids are finely powdered and passed through. The powder is taken on an ointment slab and triturated with a small amount of the base. A steel spatula with long, broad blade is used to triturate. To this, additional quantities of the base are incorporated and triturated until the medicament is mixed with the base. So finally, the liquid ingredients are incorporated to avoid loss from the splashing. A small volume of liquid is poured into the depression in the ointment and thoroughly incorporated before more is added in the same way. The splashing is more easily controlled in the mortar than the slab. So it is nothing but here the preparation of ointment we have seen in the last video. The first method 1 and 2 was followed the principle of fusion technique. Here trituration technique. These two are basic techniques. In fusion we are going to use the melting as the base method for fusion technique. Second, trituration by giving stress in a single side rotation by using mortar and pestle. The same pattern trituration is done on an ointment slab. Example, Whitefield ointment. Here it was the formula is given and the mixing method procedure is given. Second one, here I have mentioned the stability of ointments. The ointment should remain stable from the time of preparation to the time when the whole of it is consumed by the user. To stop microbial growth, a little amount of preservatives is added in several semi-solid preparation. Especially here also in ointment, we include benzoate derivatives, phenol, benzoic acid, ascorbic acid, methyl paraben, propyl paraben, quaternary ammonium compounds, mercury compounds in least percentage as a preservative. Preservative should not react with any of the component of the formulation. It's quite normal. Excipients, especially the diluent or any other preservatives, coloring agents, should be inert in nature. Some ingredients like wool fat and wool alcohols are susceptible to oxidation. Therefore, a suitable antioxidant may be incorporated to protect the active ingredients from oxidation. So, the drugs which are likely to hydrolyze must be dispensed in an anhydrous base. Humectants such as glycerin, propylene glycol, and sorbitol may be added to prevent the loss of moisture from the preparation. So ointment must be stored at a optimum temperature, otherwise it may be emulsified and remixing continuously, and difficulty will be there in uniformity of drug distribution. So these are all few points to be focused to avoid the unstable problems in the ointment products. So as follows, here some manufacturing directions for beta-methazone ophthalmic ointments has been given with the formula for the viewer's reference or learner's reference. So next, as a continuation, we are going to discuss about creams. These are also categorized under semi-solid preparations containing one or more medicament agents dissolved in either an oil in water type emulsion or water in oil type emulsion. Another type of water washable bases are advisably used in this. Examples here I have given some vanishing cream and cold cream shows in the market. So creams find primarily application in the topical skin products to make the skin wet, especially the moisturizing cream is the best example. Many patients and physicians prefer cream to ointment because they are easier to spread and remove. So manufacturers frequently manufacture topical preparations of a drug in both cream and ointment basis to satisfy the preference of patients and physician. Examples of creams are described as follows. Here hydrocorticones creams and manufacturing directions with formula has been given. And as continues, next is gels. So gels are semi-solid systems consisting of dispersions of small or large molecules in an aqueous liquid or vehicle rendered jelly-like by the addition of gelling agent. So among the gelling agent, the synthetic macromolecules, example carbomer in different grades. Here I have mentioned 934. Cellulose derivatives, CMZ, HPMZ, and natural gums like tragacanth are advisably used for its gelling characteristics. So most probably all these gelling polymers used here as a gelling agents are high molecular weight in nature. So here the viscosity depends on the polymeric composition based on the grade, as I said earlier, different grades for same polymer, different molecular weight difference will be there, but high molecular weight substances are used here. They are used as gelling agents at concentrations of different from 0.5 to 2.4 percentage in water. So carbomer yields highest viscosity between 40,000 and 60,000 centipoise as a 0.5 percentage aqueous dispersion is used. Gels are sometimes called as jellies. So gels can be two types based on the nature of phase, single phase gels and two phase gels. Based upon the number of gelling agents used in it, it may be named as single phase and two phases. So here preparation of gels, water soluble components dissolved in the vehicle. The hydrophilic polymer add the mixture slowly to prevent aggregation and stirring in continued until dissolution of the polymer has occurred. And excessive stirring, note, excessive stirring results in entrapment of air. So example of jellies here, chlorhexidine gel formula is given and manufacturing direction follows. Preservatives of semisolids. The topical preparations are not designed to be sterile. The microbes may be present or grow in like water removable and water soluble bases. The two categories are concerned that cause pathogenic symptoms. Example Staphylococcus, hemolytic Staphylococcus, Pseudomonas E. coli. Those causes spongylus. Example molds and yeasts. So ideal preservative, effective at low temperature, non-toxic, compatible, and appropriate oil in water partition coefficient is to be noticed. Effective at pH level of the product. The selection maybe depends upon whether it is going to be used for ointment or what type of semi-solid we are going to use, and physicochemical properties should be focused. The site of application, commonly used preservatives are benzoic acid, theta hydroxy benzoates, quaternary ammonium compounds, sorbic acids. So packaging of semisolids, topical dermatologicals, its semisolids are categorized under dermatological preparations, are packed in jars or tubes. Collapsible tubes are advisably used, whereas ophthalmic, nasal, vaginal, and rectal semisolids are almost always packed in tubes. The plastic containers are popular over glass and metal. Between lightweight and the back broken prone, less breakage should be there, and the lower shipping cost, and it should be like a convenience of silk screen, easy for application, the spreading property, plastic heat transformed labeling should be there, and the disadvantage, risk of permeation into and out of the product. So other types of dermatological products are lotions, pastes, powders, and aerosols. Applications of dermatologicals. They are used in different purpose, like dermatological agents as a protectives, and then absorbents in wound healing property applications, and demolitions for mucous membrane or abraded tissues to as an anti-inflammatory, and emollients, fat or oily substance used to increase the moisture content on the skin, like moisturizing agent, and estrogens for to arrest the blood hemorrhages, counter irritants, rubifications, castics, and cardiolitics. These are all few applications of general semisolid preparations, especially for ointments, creams, gels, other products in semisolids. So thank you for listening these four parts of video regarding semi-solid preparations. I have briefed about all its advantages, disadvantages, bases. So kindly go through all the four volumes, four parts to easy understanding of semi-solid preparations. Thank you all.